Hi guys, welcome to another video. Today I want to talk about being a PSW during coronavirus and how it has been so far. What is a PSW? A PSW is a personal support worker who is helping residents with activities of daily living, so things that you do every day that you don't normally need help with, but these people have conditions, etc. that leads them to needing more help. Question number 2 is, where do you work? I work at a long-term care home in Canada, Ontario. Question number 3, how long have you been on lockdown? So we've had a couple of lockdowns since the new year. It hasn't just been corona that's going around. There's other respiratory viruses and enteric. We were in lockdown early on in the beginning of the year, early March, and we've continued to be on that same type of lockdown. So it's been almost 3 months right now for my nursing home, where the residents are not allowed to leave their rooms. They are isolated to their personal rooms. It was only yesterday that we are finally on outbreak for coronavirus. We had test results come back. We know we have corona in the nursing home. Right now, all of our residents are asymptomatic. Obviously, things can change. We're grateful for that right now, but we'll see what happens in time. Question number 4, do you feel safe? What's the PPE situation at your workplace? Personally, I haven't felt safe since this whole thing hit Canada. We've had a shortage of staff and PPE for years. It's not automatically just going to be fixed because you're getting a bunch more funding. I'm not shit-talking my nursing home because they do provide PPE to us when we need it. If our mask breaks, we can go get another one. They're not refusing to give us a new mask. It makes me uncomfortable saying that yes, we're being provided PPE when we're also being told that you have to reuse that PPE for longer than a period of time that we were taught to for infection control purposes in school. That makes me feel uncomfortable. Our staffing is in a really good place right now at the nursing home. There was a period of time where we were starting to get short-staffed. We were relying on agency, and that's scary because agency typically travels home to home. We didn't want to invite corona to our nursing home. It's also a little concerning because now, what are they doing for work? Are they out of work? I don't know. Care aides come in and help us, so just anybody who wanted to volunteer to help out at the nursing home, they were getting paid $18 an hour. And they were making beds, taking out the garbage, helping with feeding residents, answering call bells, like anything that they could help with that wasn't considered personal care. But they haven't been around lately either, now that we have enough PSW staff. It's interesting with PPE because some nursing homes are allowing their staff to have N95s, whereas my nursing home has been very strong in this, that we do not need N95s. It is not airborne procedure where you're gonna need an N95, so our nursing home has said, keep those N95s for when they're needed, otherwise you are wasting them. And then other nursing homes I've seen, they're all wearing N95s already. So it's different place to place, and it makes you wonder why. Some places are wearing goggles, some places are wearing face shields. It's not the same nursing home to nursing home. Question number 5 is, what is the protocol for a likely positive corona resident? So what we've been doing is, if we have a probable case, we test them. They're obviously already isolated, but they continue to be isolated. Instead of wearing what we normally wear entering the rooms, which is always a mask and goggles for care, we are now, for that isolated probable corona case, everything, and we do that until their test result comes back negative, basically. They are also now testing all the residents in the room of a probable case and all the adjacent rooms to that room because of the likelihood of transferring the virus to a coroner or whoever is coming in to get that body, the funeral director. You guys might already know of this change, but the staff in the nursing home now brings the body out for the funeral director or the coroner because it reduces their risk of contracting it from anybody else in that home, because they're only there for that one person. So let's make it easier to get only that one person to them. Some PSWs are a little upset by that, having us take out those who have passed away, but I don't see a problem with that because you've been working with that person every day. You know them the most. Taking them out is their final goodbye. We have had residents pass, not from corona. They were tested, they came back negative, they passed for other reasons. But it's scary because you know with corona coming, that could cause a lot more deaths. Question number 6 is how are they testing the staff, us? So when we come in, we have to take our temperature, check it down on a piece of paper, sign for it, and then we leave the same thing, temperature again. We're also monitoring for any symptoms. Obviously, visitors haven't been allowed in the nursing home since March. Even like certain services aren't delivering into the nursing home, they're dropping off at the door. So food deliveries, we have to go to the door to get that. They're not bringing it in. I believe our laundry services, they're still coming in to get the items, but they are wearing their mask and gloves, what they need to wear to be safe. I've seen a lot of conversation online about visitors being the ones to bring it in, and I don't think that's the case when, in our case, we haven't allowed visitors for months, 3 months almost. Question number 7, have the residents been tested? So Ford is claiming that all the residents and all the staff are being tested. That is false. It's not mandatory. Telling everyone that this nursing home has all been tested, all the staff's been tested, that's not true because there's some staff at that nursing home that just refuse to be tested. You're spreading false information. Not everybody's being tested and it's not mandatory. And that's not the nursing home's fault either. Do not blame your personal nursing home for this. This is the ministry's fault for saying that it wasn't mandatory. They're also the ones that are saying that we can go back to work, healthcare workers, after 72 hours if we're asymptomatic with a positive test. Why is it 72 hours for us, but it's 2 weeks for everybody else? Are you really protecting our residents? Question number 9, how have the residents been handling it? It's kind of like having cabin fever. Some of them don't really know their environment and they can't voice how it's affecting them, but the ones that do understand are really struggling. They're not wanting to sit in this little room that they barely have enough space to do any exercises, move around in. They're wanting to get out, go for a walk. They want to do something because they're bored. They're worried for their families. They miss their families. Some of them have been able to visit their families through the windows. We've been doing FaceTimes with their families so they could talk and see them, phone calls. You go in every day and they're asking you, when can we come out of our rooms? When are we allowed out? Oh, when is this whole thing gonna be over? And you want to give them a little bit of hope, but you don't know yourself when it's all gonna be over. Question number 10 is, do I want to be at work? My answer is a yes and a no. I don't want to put myself at risk of getting it and bringing it home to my son. He's only a year old, just turned 1, with the disease going around that's affecting children. It's starting to scare me because it's new and we don't know enough about how it's affecting children. But at the same time, I don't want to not be working and know that nobody's there to take care of the residents. People get scared when it's a probable corona, when it is a positive corona, and you'll see some people, they don't say anything, but they do remove themselves. That's when I step in because I'm like, well, somebody has to take care of them. Somebody has to be going in and talking to that resident. Just because they have coronavirus doesn't mean that you can treat them differently. If you guys have any questions for me, stuff that I didn't mention, go ahead and comment it down below. If you're wanting more information about corona, go to the Ministry of Health. Go to your health unit page. Please don't rely on misinformation because there's a lot of it out there. I just wish that more people could see what's actually going inside those doors of nursing homes. And unfortunately, I can't even show you that because, you know, privacy and confidential reasons. Let's talk about this a little bit more. What are you going through at your workplace? What's this all been like for you? If you guys make a video in regards to this, link it down below. I'll watch it and let's start a conversation. Alright, have a good day guys. This is the end of the video. Goodbye.